Let's get into vitamin D. Vitamin D. A whole lot of research in vitamin D, and I'm going to go through a lot of these research articles right now. This first one, vitamin D intake and the incidence of multiple sclerosis. This is out of the journal Neurology in 2004. And when I mention a medical journal, by the way, as I go through these articles, these medical journals can be found anywhere. You can find them online. You can go to PubMed, the U.S. government's online database of all of these research articles. So if you want to check this stuff out, it's pretty easy to do. And at least to see the abstracts, it's free. Just go to PubMed, pubmed.gov, and check this stuff out. What I did is you can go to PubMed and put in vitamin D and cancer, vitamin D and multiple sclerosis, vitamin D and depression, and so on. And all of these articles will pop up. This one out of Neurology, it talks about the incidence of MS is low in the tropics. So the closer you move to the equator, the less MS you have. The further you move away, the more MS you have. Why? Sunlight. Where do we get vitamin D? We get it from the sun. As our skin is exposed to sun, and not in January, sorry, in northern latitudes, even if we were to be able to go outside in New England in January at noontime when the sun is highest in the sky, the sun is too low in the sky, too many of the UV rays are absorbed by the atmosphere to make it effective. So we need supplemental vitamin D. The beauty of all these research articles, I'm going to tell you right now, is vitamin D is dirt cheap. That goes right back into saving money on healthcare. Imagine if we got everybody on cheap old vitamin D, D3 by the way, cholecalciferol, not vitamin D2 ergocalciferol. It has to be D3. Most of the stuff out there is now D3. If we get everybody on D3, you're going to see some diseases that will go way down in their incidence. Individuals with MS tend to have insufficient levels of vitamin D. This particular study I'm mentioning now found that women who use supplemental vitamin D had a 40% lower risk of MS. 40%. By giving people $25 worth of vitamin D per year, we can reduce MS by 40%. Can you imagine what that would save us in healthcare costs? Taking vitamin D supplements for more than 10 years lowered the risk of developing MS by 59%. Let me round it up to 60. Almost 2/3 of MS can be lowered by cheap old vitamin D. We're talking $25 a year. Whereas some pills and the average adult in this country is on something like 12 to 14 prescription medications every single day. Let's call it $25 a pill. Never mind, we're talking about $25 a year to get everyone on supplemental vitamin D. That's awesome. Next article. Journal of the American Medical Association in 2006. Serum 25-hydroxyvitamin D, D3, levels and risk of MS. Again, vitamin D levels earlier in life may be critical in conferring protection for MS. Vitamin D, here's an additional benefit for vitamin D. Vitamin D supplementation in infancy seems to exert a strong protective effect against the autoimmune disease, type 1 diabetes, and vitamin D levels in early childhood could have an impact on the risk of MS. When somebody has type 1 insulin-dependent diabetes, that costs us a lot of money, and there's a lot of suffering from that as well. Imagine that there seems to be a strong protective effect against getting type 1 diabetes just from this little vitamin D thing in early infancy. $25 a year. Wow. Half of whites and 2/3 of black adults in the United States have vitamin D levels below 70 nanomoles per liter. That's the measurement tool. You can just remember the number 70. Best should be between 90 and 100. That's pretty darn high, actually. But other research will back that up as well. Okay. Next article on vitamin D. Fighting infections with vitamin D. It was interesting in this article out of Nature Medicine in 2006. In 1895, Niels Finsen, I hope I'm pronouncing that correctly, of Denmark effectively treated TB, tuberculosis, with high-intensity light produced from an electric arc lamp, basically increasing vitamin D. Vitamin D stimulates the synthesis of the potent antimicrobial peptide called LL37 in the skin. You don't have to know all the chemistry about this, which makes up the innate immune response. this improves immunity, which is going to improve your ability to fight infections like the flu. And that's what this article was getting into. Okay. Vitamin D influences both the incidence, and survival of cancer as well. So that's what these articles are saying. Not only is it helping you fight infections, not only is it helping you protect yourself from MS, and I get people with MS on vitamin D and fish oil, it is also showing to be fighting infections, lower rates of flu, which costs us a lot of money. Now we're seeing research that says we're going to lower the rates of type 1 diabetes with $25 worth of vitamin D per person per year. Epidemic influenza and vitamin D, another article that talks about lowering the rates of flu with vitamin D supplements. Vitamin D has a profound effect on innate immunity, once again, your natural ability to fight infections and viruses. In 2007, a study of 104 women given vitamin D were 3 times less likely to report cold and flu symptoms than placebo. We give people a little bit of vitamin D, they have a 3-time lower rate of getting colds and flus. I mean, this stuff just goes on and on. This is the one I really wanted to get to. Vitamin D for cancer prevention. $25 worth of vitamin D per year per person is going to lower cancer rates. So this is out of the Annals of Epidemiology, 2009. This is a July 2009 study, very current. Higher serum rates of vitamin D3, some of the levels that I talked about earlier. And by the way, I have a great vitamin D article on my website. Higher vitamin D is associated with substantially lower incidences rates of colon, breast, ovarian, renal, pancreatic, and aggressive prostate and other cancers. You increase your vitamin D, you have lower rates of all these cancers that I just listed. Raising vitamin D levels to 40 to 60. And when you get a blood test, ask your doctor, what's my level? It's going to be a whole number between 0 and 100. A lot of you and a lot of my patients that I've asked this, I've seen as low as 9 or 15 or 20 or 25. If we can lift that to 40 to 60, it would prevent approximately 58,000 new cases of just breast cancer. 58,000 new cases of breast cancer would be eliminated per year, and 49,000 new cases of colorectal cancer each year. Back to prevention. $25 worth of vitamin D per year to lift your vitamin D levels. We're talking about prevention and saving money with something very simple. Wouldn't it be nice in these clinics that I'm suggesting around the country that everyone got their vitamin D level tested? And we just simply got these people that are not getting enough sun. Let's say that they live in New Mexico or Arizona and they are out in the sun enough. You don't need supplemental vitamin D, by the way, if you get enough sunlight during the year, but most of us can't, and it's just unavailable to us. Imagine if we had just vitamin D available at these clinics. Maybe it's subsidized. Maybe it's actually paid by Medicare. Maybe it's paid by these federal stimulus money. $25 per person per year. It's simple. We're talking 2,000 international units of vitamin D3 per day, approximately 220,000 new cases of breast cancer, and 254,000 new cases of colorectal cancer would be prevented annually in the world, by raising serum vitamin D concentrations to 40 to 60. I mean, that's awesome. $25 a year. We're talking knocking down 50,000 cases of breast cancer and another 50,000 rates of colorectal cancer in this country per year. Are you talking about prevention? Wouldn't that be pretty cool? We might get some resistance from very large companies and corporations. I don't know if we will get some resistance, but theoretically we could get some resistance from, let's say, pharmaceutical companies and so on. Maybe that they say we need pharmaceutical-based vitamin D or whatever. I say, no, you don't. Cheap vitamin D already exists. National Academy of Sciences recommends adequate intake of vitamin D3 to 2,000 to 4,000 international units per day. Most of your supplements are probably not giving you enough. Another article, autism and vitamin D. Autism is more common in areas of impaired UVB penetration, such as northern latitudes, areas of high pollution, areas of high precipitation, less sunlight. Should we give kids vitamin D? Well, I just said earlier, it will help reduce the chances of type 1 diabetes. Now we're talking about reduced chances of autism with 25